Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 165. A 57-year-old woman complains of weakness, dyspnea, loss of appetite, and liquid feces. She has been suffering from this condition for 2 years. Objectively, she presents with pale skin, subicteric sclerae, and bright red fissured tongue. Lymph nodes are not enlarged. Pulse 100 per minute. BP 105/70. MHg. Liver plus 3 cm. The spleen cannot be palpated. Blood test. Erythrocytes 1.2 × 10 to the 12, L, HB 56. G, L. Color index 1.4, macrocytes, leukocytes 2.5 × 10 to the 9, L. Eosinophils 1%, juvenile 1%. Metamyelocytes 1%, band neutrophils 8%, segmented neutrophils 47%, lymphocytes 38%. Monocytes 4%, reticulocytes 0.1%, platelets 110 to the power of 9, L. ESR 30 mm per hour, indirect bilirubin 26 mmol, L. What changes can be expected in the bone marrow puncture material? A. Presence of blast cells. B. Erythroid hyperplasia. C. Prevalence of megaloblasts. D. Increased number of sideroblasts. E. Prevalence of lymphoid tissue. Color index in the general blood count can be used to determine the content of hemoglobin in erythrocytes. The normal range is 0.84 to 1.11. It is used for the differential diagnosis of hypo, normo, and hyperchromic anemias. However, for a complete diagnosis, this value alone is not enough. It is a rather old parameter, which is supplanted by the mean corpuscular hemoglobin, MCH, and a more modern one, automated blood analyzer. It can be microcytic, normocytic, and macrocytic anemia, depending on the size of the erythrocytes. For example, in microcytic hypochromic anemia, the body has low levels of erythrocytes that are both smaller and paler than normal. Anemia associated with color index. Hypochromic anemia. Color index is less than 0.84. Normochromic anemia. Color index is 0.84 to 1.11. Hyperchromic anemia. Color index is more than 1.11. Normochromic anemia. Aplastic anemia. The bone marrow cannot make enough new blood cells for the body to work normally. Posthemorrhagic anemia. Acute or chronic bleeding. Hemolytic anemia. Intravascular or extravascular hemolysis. Anemia of chronic disease. When the kidneys are damaged, they produce less erythropoietin, a hormone that signals the bone marrow to make red blood cells. Hypochromic anemia. Iron deficiency anemia. Deficiency of iron and vitamin B6. Iron deficiency typically causes low serum iron, high iron binding capacity, and low serum ferritin levels. Hookworm. Infection interrupts nutrient acquisition by the host through its ingestion and digestion of host blood, resulting in iron deficiency. Heavy metal poisoning, e.g. lead poisoning, copper toxicity, can cause anemia. For example, in lead poisoning, high blood lead levels are associated with low serum iron and ferritin. Thalassemia. Violation of the synthesis of proteins and other compounds that make up hemoglobin. X-linked sideroblastic anemia. An inherited disorder that prevents erythroblasts from making enough hemoglobin. It results from a combination of reduced hemoglobin and an overload of iron. The symptoms include fatigue, dizziness, tachycardia, pale skin, and hepatosplenomegaly. Hyperchromic anemia, megaloblastic anemia. The bone marrow produces stem cells that make abnormally large red blood cells, due to deficiency of vitamin B12, cobalamin, and vitamin B9, folic acid. Pernicious anemia is a type of megaloblastic anemia in which the body is not able to absorb vitamin B12 due to a lack of intrinsic factor in stomach secretions. Congenital spherocytic anemia, hereditary spherocytosis. It also causes jaundice, splenomegaly, and an elevated risk of gallstones. Other causes: toxic damage to the bone marrow, overdose or long-term treatment with cytostatics, anticonvulsants, antiviral drugs, hypothyroidism, dysfunction of the liver. Absence of vitamin B12 and B9 can impair DNA synthesis, that leads to megaloblastic anemia. As the DNA does not synthesize normally, nuclear maturation is delayed, while cytoplasmic maturation continues at normal rate. Thus, megaloblasts, mature cytoplasm with relatively immature, large, open nucleus. Large red blood cell precursors form in the bone marrow. Large number of abnormal precursors undergo intramedullary apoptosis, that leads to anemia. Additionally, impaired DNA synthesis leads to ineffective hematopoiesis in all three cell lines, pancytopenia. The answer is C. Prevalence of megaloblasts.